Hello and welcome to Study Topics. This week we're going to be covering the 4 things you need to know to pass your written competency exam. Tip 1. Have a plan. Your study plan can differ depending on a ton of factors. For example, are you a mom? Are you working full-time, part-time? Have you been studying for a long time? Did you graduate recently? These are all things that we need to consider when thinking about how long you need to plan to study. So you need to factor these questions in, but typically we suggest a 4.5-month study plan. So all of our courses, our video course as well as our live course come with that plan of about 4.5 months. Now it's really easy to adapt, but you need to set something in stone and try to stick to it. So if you're unsure about how long your plan should be, definitely reach out to me. We can chat, we can learn a little bit more about your specific situation. But again, before you even start, create a plan. Okay, tip 2, start with anatomy. It's imperative that you know your basics before going through the material. So this will be the fundamental or the foundation to everything that you're going through. Start with basic anatomy. Know your origins, insertions, actions, innervations, like really well. If you're someone who uses cue cards, this is a great place to use them. If you've heard me talk about cue cards, you know that I detest them, but for anatomy, it's a good idea. So in order to truly understand the mechanisms behind different pathologies, again, you need to know your anatomy. So once you have the basics, start layering it on. If you're unsure where to start, check out our anatomy workbook. It's really helpful, or you can go and check out any of our other videos on YouTube too. We cover a ton of videos on anatomy. All right, tip number 3, compare and contrast similar pathologies. So this is one of my favorite tips because it really comes into hand when you're getting into those situations where you can't decide between 2 potentially right answers. So one of the most common feedback I get from students after doing the written exam is that of the 4 answers, 2 of them were clearly wrong and 2 of them they really couldn't decide between. So this is when you want to have utilized this strategy. I suggest taking pathologies that are really close and trying to figure out what makes them close and what are those subtle differences that you can kind of figure out why they're different. So for example, take a pathology like carpal tunnel syndrome and put it up against thoracic outlet syndrome. Another great example would be something like bronchitis and put it up against emphysema. Now, we give you really detailed charts of this in your manual, but if you're not in the course, this is something you'll have to create for yourself. So other ones that I want to throw out there and make sure you practice would be things like ALS and MS. Again, if you need help with these, definitely look in the manual and that will give you a breakdown in these really nicely constructed charts. All right, this brings me to my last tip, tip number 4. Make sure you're practicing Canadian vignette style questions. So one of the biggest mistakes I see people make when they're studying for the written exam is they purely study standalone questions. These are commonly seen on the American exam or the MPTE exam. Now, I won't name any resources or books that I hear are commonly used, but if you're using them, you know them. And you just really have to be careful with them. Not saying don't use them, but you need to spend time practicing vignette style questions. Now, vignette style questions are case-based or paragraph-based with multiple questions that kind of relate to that vignette. So it's really important that you practice this skill. Now, we have options available for you to practice. If you're in the course, you have your course mock exams, but we also have 3 unique 200 question exams on our website. Mock exam 1, 2, and 3. Now, don't get discouraged if you don't score well on these exams. Our exams are difficult. They're made to find gaps and holes in your knowledge so that you can go and refine that before your exam. So I suggest trying to take these exams, around 3 weeks before, 2 weeks before, and 1 week before. In every exam you take, you're going to get a breakdown for how many questions you got right in, say, MSK, how many questions you got wrong in neuro, and that's going to guide you of where you need to go and spend time studying in these kind of final crucial days before your exam. But that's it. Those are my top 4 tips to help you pass your written exam. So good luck and thanks for joining me.